Listeners, you know about the Deep Sea Foundation YouTube channel, and that's where we publish interviews, but we also have them over on the Deep Sea Journey podcast. Now, this interview today, you will be able to listen to and watch on both of those platforms. But as one who does interviews, I also look to other channels to cross post information and resources so that we can reach a wider audience. And in this case, for those affected by cancer, but more specifically on our channel for those affected by breast cancer. And I'm going to share one of those YouTube channels with you in this interview today that I think will be beneficial to our followers. The YouTube channel is called Cancer Fitness. The host is my friend, Dr. Jay Harness, who I warmly welcome back from interviewing him previously about the Maple Tree Cancer Alliance and all the things that they are doing globally. Dr. Harness is a chief medical officer at Maple Tree Cancer Alliance, but his new initiative aligns very closely with this work and is called cancerfitness.org. You've got to check out that website. We're going to actually do that this morning on the interview. It's full of valuable information. And if I were to summarize my thoughts on the website, I would say it empowers cancer patients to not only understand the benefits of exercise before, during, and after cancer diagnosis, but it aims to guide you in reclaiming your body after the often dilatory effects of cancer treatment or surgery. He is a trained cancer surgeon who has positively impacted so many lives and is turning his focus to exercise oncology. Welcome back, Dr. Harness. So good to see you.
Oh, Terry, thank you so much. And you and I are such good friends, along with Manas and others. So please call me Jay.
Okay.
It's really you'd find this interesting. Whenever I'd walk in and meet a brand new cancer patient, I always looked her right in the eye, put out my hand to shake her hand, and said, "Hi, I'm Jay." I
Oh,
almost never have introduced myself as Dr. Harness, and it's part of my connecting with patients and empowering them. So
I
it's
love
a
it.
real treat to be with you. I'm thrilled to be here today.
Oh, I'm so glad to have you back. Um, you know, listen, I think the best thing to do, I was so excited this morning before we started recording that you are actually going to share the website, which we also talked about eventually after when I get all of this accomplished, I'm going to put it on the Deep Sea Journey blog resource page. So watchforcancer.org on there, cancerfitness.org on there. And we're going to just cast a wide net today, Jay. But I'm so
Well, thank you.
excited that you're going to share your screen. So I'm going to
Yeah.
let you set that up and we're going to get going because as you're doing that, I'm going to ask you the question, the resources that you provide. And to me, there's just no better way to do this than to show the website. So I'll let you start screen sharing when you're ready. Okay, great. We've got your website pulled up. So Jay, can you begin just going through it and showing all the resources it provides? It's such a great website.
Well, thank you very much, Terry. One of the questions that's always been asked me, and you did in the script that you prepared for today, was wait a minute, how in the world did a guy like Jay Harness get involved in exercise oncology? And the answer to that question is I discovered all of this area of research about 7 or so years ago and was absolutely amazed that I really knew nothing about it. And the reason for that is that all this research had been conducted by fantastic PhD researchers in exercise physiology, kinesiology, even sports medicine, starting back in the early 1990s. And so all of this literature, over 3,000 clinical trials, 30,000 publications, have been primarily in their literature. And I felt there's been so little crossover to the medical literature, let alone medical oncology literature, that I needed to start the website. So you see this older couple sort of walking along together, and we start off by saying that vitality starts with movement. You know, the average age of cancer patients is typically mid 60s, so this is an appropriate way to sort of begin the site. So let's go to the introduction part of the site, and let's start taking it a step at a time. And
Okay.
as I say here, you have cancer. Those are three words nobody ever wants to hear. But have hope and have power, because in an integrative cancer approach, which is where we're going, it ends up that exercise becomes a really important part, Terry, if you will, of an integrative approach to all of cancer care. And those other aspects can include an acupuncture, naturopathic, holistic therapies, etc., but particularly modifications in diet and lifestyle are really very important, and that includes exercise. And a prescription of exercise really helps to reduce fatigue, stress, and improve overall physical function.
And
So as we
I think Jay, not to interrupt, but before all this research came out, to put the word exercise with cancer treatment, we just didn't talk about it. So this is
exactly.
yeah, so
In
valuable.
fact, the average medical oncologist, Terry, would say to patients, go home and rest. You need all the rest you can get. And actually, it ends up that rest is really counterproductive, because we need to be moving to stimulate the mitochondrial little power factories in our body to help actually overcome. So, one of the, other than getting over the acute treatments, to recover post surgically or couple days after chemotherapy or whatever it may be, yes, you need to rest during those times. But after that, you really need to get moving. Okay. So, as I said earlier, research has identified exercise as one of the essential components of every cancer treatment program. And we go through and talk about that. We do have the warning here to consult with your physician before starting any fitness regimen to assess the health implications that may be in your case. And we like to have people work with certified exercise specialists who can then create an individualized exercise program depending on the type of cancer. And I know you've got questions about, wait a minute, Jay, don't most Americans don't exercise in the first place? So how do we get them exercising? Okay. Here's a video that I want to really strongly recommend to everybody. It's called Moving Through Cancer. In layman's language, it just beautifully describes what this whole discipline of exercise oncology is all about. It's on YouTube, easy to find. Just search Moving Through Cancer. And Terry, on your resource page that you were talking about, that would be one of the links that I would strongly recommend for you on your research page. Okay.
Okay.
And then people say, well, gee, Jay, what are the benefits of exercise for people with cancer? Well, there are treatment specific benefits, lessening fatigue, lowering the chances of co occurring diseases, including diabetes and heart disease, from getting worse, helps to improve vital organs, and this whole list of improving recovery time from surgery, decreasing the side effects of chemotherapy, and in certain cancers and many situations, actually improving survival rates, and then lowering the likelihood of other cancers coming in the future. And then obviously under the general health conditions, reducing the risk of falls, just this whole shopping list of things, preventing muscle loss, building strength, strengthening bones, increasing the quality of your sleep and overall well-being, we're helping to support weight reduction programs, improving lung function. So it's across the board the kind of benefits that there are. Then on the website, we've got an outline here of exercise guidelines for cancer patients, including the type of exercise, like aerobic exercise, how often you should do it. And the key factor here is starting slowly. I mean, just getting out and walking, if you will. And then resistance training to help with muscle mass improvement, flexibility, etc. And then combining all of these things together. You talked about Maple Tree Cancer Alliance. At Maple Tree, we have a prospective database of over 15,000 patients. Terry, what do you think what percentage of those 15,000 patients were exercising on even a moderately regular basis? You want to take a guess?
Oh, 20%?
Actually, that's the real close to the national reported average. The national reported average of people that exercise regularly is around 21, 22%. So you're spot on. But when
I
it
didn't
comes
read
at
the
least
study.
to this database that we've got on cancer patients, it ended up being around 11 to 12%
Mm,
of the newly diagnosed cancer patients were exercising all regularly. And that can include playing golf, doing yoga, doing Pilates, doing all sorts of other things, pickleball, whatever. Only about 11, 12, maybe up to as high as 14% were exercising pre-diagnosis. As you may recall from your prior interview with myself and Karen Wonders from Maple Tree, Karen mentioned anecdotally that she's had patients through the years more worried about starting exercise than they were having their chemotherapy.
mm,
Okay? So
yeah.
the idea is just get moving. On the site, we have a whole bunch of success stories, patient success stories that are really heartfelt and how it really helped them at every aspect of their recovery and getting through. And as I said earlier, start small in the first 3 to 4 weeks, maybe increasing your walking duration up to 15 minutes, start walking more frequently, and then after 1 to 2 months and then making simple habit changes in our lifestyle. Instead of taking the elevator and you've only got to go up one flight, how about going up the stairs instead? Okay. So these are some of the things that we've got here on the website. And then as far as motivational stories go, I'd like everyone to take a quick look at our videos page, where we've got a variety of videos here from cancer survivors, one of the leading radiation oncologists in the country, Ryan Lewinda, who also practices integrative oncology and refers patients for exercise. We've got diet recommendations on the site. Here's another radiation oncologist who is actually a choreographer who has all sorts of routines to recommend to people to start moving and get dancing. And here's one of the most incredible stories of all, Dr. Dawn Musalem. Dawn is a physician at Mayo Clinic in Florida. When she started medical school here in Phoenix, where I'm located, a few months into medical school, was diagnosed with a massive upper mediastinal tumor, underwent debulking surgery to get it off of her trachea and upper mediastinal structures, followed by chemotherapy, followed by a bone marrow transplant, followed eventually by radiation therapy. They told her she needed to drop out of medical school, which she didn't, finished medical school, went through her residency training, got married, had a baby. This is a few years later now, about 3 or 4 years later. Noticed when she was in her pregnancy that she had symptoms of heart failure. And 18 years after her original diagnosis, Terry ended up needing a heart transplant.
Oh my heavens.
And today, to meet Dawn, you would never know that there was anything ever wrong with this person ever in her whole life. And one of the keys here was that she was exercising regularly pre-diagnosis. During her active treatment, they put an exercise bike in her hospital room so she could exercise, and of course, continued on afterwards, and runs half marathons today with
Wow.
a heart transplant in place. And
What?
then we've got our blog page for both patients and physicians. One of the latest blog postings just from today, actually, are the benefits for exercise for cancer patients with advanced stage 4 disease, or the increasing rate of cancer globally, or how to get through all sorts of different exercises, a variety of things for lung cancer patients, etc. So those are some of the key findings that we've got at, and it's repeating for everybody, it's Cancer Fitness, and we are a .org, okay? So I
Yes.
would love to welcome people to the site.
Wow, that's so comprehensive. I'm just so impressed with this because I talked to a number of patients. I think food, exercise, all of those things become very complicated when you throw in a cancer diagnosis. And I really feel that patients need solid, evidence-based, gentle guidance that is attainable, it's doable for them, but it also offers support. And I just see that in your website, Jay. So I really hope that everybody checks this out. Cancer.
Yeah, and so Terry, so one of the questions I've been asked that I think your audience will be interested in.
Mm,
Well, wait a minute, Jay. If we've got 35 years worth of hardcore science, why in the world is this not a standard of care?
I know.
If we had this much science for a new surgical procedure, or this much science for a new chemotherapeutic agent, or a new form of radiation therapy, it would have been the standard of care years ago.
Yeah.
What in the world is going on here? Well, that's what I was talking about earlier. There's been all this research, but very little crossover to my own colleagues.
Mhm.
I teach regularly at the American College of Surgeons meeting. I have run a course, go meet the professor on nipple sparing mastectomies. These are what we call whiteboard sessions, where I'm allowed to have a whiteboard and a magic marker. And I get about 80, 90 people in the room, and it's a free for all. And so in the last few years, I, at the end of the session, say, raise your hand if you've ever heard the term exercise oncology. And these are breast cancer surgeons. Virtually no hands in the room go up.
Mm,
So one of the main focuses at cancerfitness.org is to try and educate my own colleagues. If you say to an average medical oncologist, what do you know about exercise for cancer patients? They think it's a weight reduction program.
mm,
Many of them are unaware of the ASCO guideline, ASCO, the American Society of Clinical Oncology guideline from a few years ago, that says that patients who are in active treatment for cure, meaning not stage 4, should be referred for exercise to handle or mitigate the side effects of treatment.
yeah.
If you look at NCCN, the National Comprehensive Cancer Network, uh, there are guidelines there in long-term survivorship. Those guidelines are very, and then a lot of people think, oh, Jay Harness, what you're trying to do is get people to run marathons or Ironman contests. No, not at all. What I want people to do is to walk 5 days a week briskly for 30 minutes. There's your 150 minutes a week, Terry, of moderate aerobic exercise, or 2 to 3 days a week of resistance training.
Mhm.
That's what we're talking about here. Okay.
Yeah. I liked one of the things that I liked that you showed us was the video that you did with the choreographer, because I think, so let's say somebody pipes up in my community and they go, I just want to, I feel like I need to start exercising and getting my body back. And I go, and I might say, well, then, go outside, go for a walk. And they might go, well, I live in Minnesota and it's the middle
Yeah.
of winter. Okay, put on some music and dance.
Yeah.
Do
Yeah.
something that brings you joy that includes
Absolutely.
movement.
Yeah, and so we really want to emphasize the point you just made, and that's the sustainability of this.
Mhm.
First of all, post-active treatment, most patients don't want to go back to a medical center for follow-up exercise programs. So out in the community at the YMCA's is a good example, or the Live Strong program. So
Yeah.
those are available across the country in many community centers. Some of the Jewish community centers are also starting up exercise programs for a cancer survivor, and even some fitness centers. But then you've got people who say, "Oh, I don't want to go to a fitness center and a gym and all that sort." Okay, great. How about joining a Zumba class? How about joining a water aerobics class in an indoor pool or an outdoor pool? How about joining something, as you just said, that's fun because you're going to go back and do it more? One of the really brilliant clinical trials that was done involved doing the exercise as a couple.
Mm.
The clinical trial, this was in breast cancer. And so the way the trial was set up, the partner or husband came with the wife, or if it was a male breast cancer, the wife with the male breast cancer patient to an exercise setting of some sort. So they were there doing it together as fun. Okay. So your point about this, Terry, is really well taken.
Well, I think what I'm happy to see is that we're talking about it more. So, for
Yeah.
instance, I was as we're recording this, I mean, it's late September, we're moving into October, but I was just at a conference in Portland with the Benitera Foundation, who also brought up the importance of exercise and wellness. And what they said was, and this is, I think, the point that I want to make, is that through our cancer treatments, we have more folks who are surviving cancer, living longer. However, they still are feeling some of the effects of that, and how important exercise oncology continues to help people even after treatments and surgery. So I'm glad we're getting the message out there on various platforms.
Yeah. Again, another outstanding point by you. We need to think of this as a continuum of care,
Yep.
actually starting with prehab.
Yes.
The triple negative breast cancers, the HER2 news, virtually all those patients are going to get neoadjuvant chemotherapy.
Mhm.
So let's get them moving and get them going as we ramp up to get the neoadjuvant chemotherapy going. Then during active treatment, if someone's receiving adjuvant therapy after they recover from their surgery, we have a ton of data about how much better patients do during chemotherapy with exercise.
Mhm.
And then particularly then continuing out into long-term survivorship.
Yeah.
And we're not only, and as you've been emphasizing, we're not only talking about the exercise part of this, but the diet part of this. If
Yes.
you look at the clinical trials that have combined diet management at the same time with structured exercise programs, those patients do so much better. And the combination of the two have the biggest impact on lowering recurrence rates and improving survival. So you're absolutely spot on. We also need to remember that invasive breast cancer is a lifelong journey.
Mhm.
I've had patients recur 12, 14, 18 years after the fact. So continuing that regimen of exercise, what we're learning at the molecular level is that every time we exercise, our muscles put out myokines. These polypeptides and proteins can have a suppressive effect on cancer cell growth. This has been particularly demonstrated in prostate cancer. Same is true, and we believe, in breast cancer. The immune system, every time we exercise, is kicking out killer lymphocytes and other factors necessary to handle cancer cells, as well as our overall well-being. The biggest impact of sustained exercise into long-term survivorship is actually lowering all-cause mortality, roughly around 40%. That means dying from things other than your original cancer.
Mhm.
So the data is just amazingly clear. So we want to encourage all of your watchers and listeners to exercising regularly.
Well, I'm not going to stand up, but I'm going to practice what I preach, and you've motivated me today. And I'm not going to stand up because on the bottom half of my fancy sweater for my YouTube, I'm wearing my exercise pants and I'm headed to the gym after this to do my weightlifting today.
All right. All right. Now, for true confessions, if I stand up, I have my exercise pants on underneath here, and I'm going to put on my Cancer Fitness t-shirt and head off and exercise myself. So there you go. See, we share another thing together, Terry.
There you go. And we did not plan that, listeners. That was spontaneous
Right.
there. My friend, Dr. Jay Harness, thank you so much for um, spending time with me today. And please check out cancerfitness.org. We are going to get this out to the masses so that you can listen to it and enjoy all of the resources that are available there. Thanks for joining me today. It was so great to see you.
It is absolutely my privilege, and congratulations on your foundation. My
Thank
hat
you.
is off to you. I salute you for everything that you're doing. You're
Oh,
one of
thank
my you are one of my heroes.
Oh, thank you, Jay. I really appreciate that. You started my week off well. Thanks for joining me today.
My privilege.